Different patients, different medical needs, but one desire: to get efficient and effective medical service, whether at government or privately owned health facility. However, these services are guided by a code of medical ethics that many patients may not be aware of in Nigeria.
The patient has a right to get full information about the possible treatment that is going to receive. The patient has a right to ask questions such as, okay, this procedure you are going to do, how many have you done in the past year, in the past 5 years? What are the results? He also has a right to say, now, I've heard what you've said. Is it possible that I get a second opinion? If a patient discusses any topic for that matter with his doctor or her doctor, unless that patient gives a written permission that that record should be released, it cannot be released.
In Nigeria, how much of these, rights do you see the patients are certain?
In Nigeria, it's very rudimentary. The patient just don't query or don't ask questions from their doctors. And to me, that is not good enough.
I took the question to the street.
Do you ever ask the doctor any question?
No. Why would I ask it? I didn't ask the doctor for any reason. Because he has given me the remedy for what I want.
I believe it's the duty of the doctor.
Members of the medical profession, especially the doctors, are perceived to have a strong hold on the patients, and the need to get prompt medical attention in sometimes overstretched and understaffed health facilities overshadow the patient's right to more professional and courteous service.
A doctor is a human being, but within being human, a doctor follows certain standards in practice. This is what you call decorum. A good doctor will always respect the rights of the patient. A good doctor would never, and I am insistent on this, never shout on his patient.
The doctor has been trained now to know that even if you have your own problem, you must put it aside and you must operate at the highest professional level. So there are many other mistakes that could have been committed. Talk of investigation problem, errors, maybe just collect investigation from a patient without telling the patient, or telling the patient, go and use this medication, it will work, and then you mention 1 or 2 side effects. Now you know you have to mention as many possible.
When you come to hospital, you'll be treated as expeditiously as possible, as humanely as possible, as kindly as possible. But also you have an obligation in that you need to have realistic expectations of the system.
So, in what ways can a doctor be said to be negligent in his duties?
If the doctor performs an operation and is not skillfully done, and as a result of that there's injury, or the doctor normally is supposed to tell the patient, if he wants to operate, tell the patient the consequences and so on and so forth. If he fails to do that, and there's injury as a result, that will amount to negligence.
What then are the options open to patients or their family members if these rights are violated?
If these obligations are breached, then the patient has a right to report the doctor to medical disciplinary council, or to take a legal action to seek compensation.
Do we really see, patients coming up to sue the doctor, for negligence?
No, it's not common. People don't want to take action because it's part of our traditional belief that if somebody is dead, then why do you want to make money out of it? Do you understand? Why do you want to make money out of it? So they prefer to just forget about compensation and so on. But we are saying that it is wrong.
However, the president of the Nigerian Medical Association, while acknowledging that doctors have conducted themselves in professional manners, says the body is not deluding itself that there are no bad eggs.
It is on record that for the first time in some years, we took a decision to suspend one of our members, and indeed a professor of medicine, professor of obstetrics and gynecology, because of some allegations that were made against him, which were investigated by the association, found to be substantially true. And we think government should also rise up to its responsibility, because again, they must admit that over 70% of the problems or the issues that have given rise to misconduct, either in the workplace or outside the workplace, is a result of careless government policies, government insensitivity, and of course lack of provision for the enabling working conditions.
Medical misconduct is by no means restricted to doctors. Some nurses, pharmacists and other health workers have been said to be rude and unprofessional in the discharge of their duties to patients. The situation needs to change, as a good relationship between patients and health workers is essential in achieving effective and efficient medical service. Yomi Otaigbe, reporting for Channels Television.